You're great. All right, we're going to go to Mary right now. She is with the doctor who saved her life.
That's right. This is Dr. Brett Parkinson. I've been interviewing him about mammography for the past 20 years, and he's the one who found the tumor, did the biopsy, results, everything, and really is overseeing my case. But more importantly, you've been flooded with phone calls for mammograms, and that's great news.
It is great news, and Mary, I want to thank you personally for having been public about your experience, because it's not an easy thing to do.
Well, a lot of women don't want to be public because it's a personal thing.
It's a personal thing, but when you do go public, then there's more awareness, and women step up to the plate, and they actually start getting screened. As soon as you went public, we were flooded with phone calls for women who wanted to get their first screening mammogram, so thank you very much.
Putting them off.
And they've been putting it off. And if one of those women has cancer and she tells other women, we will get the word out, and we will raise that abysmal screening rate that we have in Utah of only 60% to closer to 100%, which is what it should be.
Well, and I know you did a big study. The government came out and said recommendations are 50 and older to get mammograms, and every doctor on the planet said, no, it's 40. Start at 40. And if I would have waited till 50, I wouldn't have caught mine.
Right. You would have caught yours later when perhaps you could have felt it. And I think one of the things that your viewers should know is that your tumor was found before you could feel it.
Right.
And that is the value of mammography. Now, you talked a little bit about the United States Preventative Services Task Force no longer recommending mammography for women under 50. Well, we did a study here in the state of Utah. We looked at all the prospective randomized clinical trials and found that their analysis of those trials was flawed. They looked inappropriately at two of the major studies, came up with the wrong conclusion, and that has been debunked by the American Cancer Society and the American College of Radiology. So women, begin your screening at age 40 and every year thereafter.
Every year. Okay. And what about women who can't afford it? Some women don't have insurance. Some women have insurance, but they can't afford. I had a $100 copay for the MRI. That's tough.
Well, it is significant, especially in this economic environment. But we have the Utah Cancer Control Program.
Okay.
And for women who are low income, they can contact the number, which is 801-538-6712. Also, the state of Utah has other programs, and if they are unsuccessful with UCCP, they can always call our nurse navigator at Intermountain Healthcare, 801-507-7812.
Okay, we'll say that number again. That was from the Utah Cancer Society, and they are offering low income and free screenings for mammography. And then here are the numbers that you were talking about. And Brett, I know that you have services there that people might not know about and say, hey, I can't afford a mammogram. Can you help me find a way? And they will find a way.
We will find a way. There are grants from the Komen Foundation. We also have grants at Intermountain Healthcare. If a woman needs a mammogram, there is no reason in the state of Utah she can't have access to that technology.
No more excuses. Go get your mammograms if you're 40 or older.
Exactly.
Thanks so much, Brett, and for the future care, too. Hey, we're going to take a break, but first, here's what Chef Brian is making for 2 News at 4.